Hi, I'm happy to be here today. My name is Janice Tufte, and Danny's going to share a little bit about himself.
Okay, I'm Danny van Leeuwen, and I'm known as Health Hats. I'm a patient caregiver activist, and I'm delighted to be here talking to you today, Janice.
Great. I have a couple questions for you.
Okay.
When we're thinking about a digital learning health system as an evidence knowledge generation ecosystem where all end users should benefit, what are some of the problems that we face currently?
I can think of two right off the top of my head. The first one is that we don't collect information about what works. And what I mean by that is that we have clinical practice guidelines and other expressions of evidence. And sometimes we follow those guidelines and sometimes we don't. And sometimes they work and sometimes they don't. And it would be really helpful if we kept track of the decisions we made about evidence and what those outcomes were. And the second thing I think is that when we think about a learning health system, that communities think in terms of generations, and professionals and organizations think in terms of months and years. And those are really different frames.
Those are excellent, actually, and excellent framing and guidelines and systematic reviews and research we might refer to as artifacts in the knowledge ecosystem. So when and where are possible opportunities to include patients, families, and caregivers in the development and implementation of evidence knowledge tools or artifacts?
Well, when and where is everywhere. I think everywhere meaning to me governance, operations, learning, whether that's in research, standards development, measure development, evaluation. I think these inclusion could be absolutely and should be absolutely anywhere and everywhere.
I appreciate you sharing that. And recently, you've been talking about us that are more seasoned patients creating a legacy project. That'll be another discussion. Part of the Digital Acts Learning Health System future vision is to get the right information into the right hands at the right time. What innovations do you see might be helping to move this?
Well, I think there's really two parts to your questions. The first part is about the five rights, right info, time, person, channel, etc. And I think the other part is about innovations. And let me take the second part first. So I think for the most part, innovation is a local persistence. That means that people have a problem they need or want to solve, and they bring people together to solve those problems, and those people lead that problem solving activity. That to me is innovation. The other thing is that with the five rights, there is no one size fits all. And the challenge with that is that then the variation could be infinite because people are so different. And I think the challenge is to reduce that variation to 10 variations instead of infinite variations. In a project that I've been part of, which is a person first COVID project, one of the things that we did to reduce the variation is we thought in terms of personas. And so with COVID, the personas could be like, do you have symptoms? Don't you have symptoms? Are you in a high risk job? Do you live or work densely? What kind of transportation is your primary transportation? And so we were able to develop 7 or 8 personas based on those variables. And then we would inventory the issues and the questions according to those personas. And then we could inventory and share those 5 right innovations along with those personas.
I really appreciate that context. Talking about persistence, I think, is important when we're talking about the pervasiveness of issues that are being addressed and or need to be addressed in many communities, as you just mentioned. And so therefore, it's really about personalization, as you mentioned. I think bringing it down to perhaps 10 opportunities is an excellent idea, and how we can have that happen throughout the evidence knowledge generation, from research to guidance to action. I appreciate you today being on the call and on this discussion, and I look forward to seeing you soon.
Thank you.